you know, one nipple up, the other nipple down.
This one be uplifted 1 centimeter, this one be uplifted 2 centimeter.
Anyway, we can provide you the breast lift because you have scars.
There is a little bit asymmetry between two boobs.
Number 1, a breast lift, otherwise known as a breast mastopexy, can be combined with a breast augmentation. So that way you get your breasts raised and you get your nipples sitting at quite a good height on your breasts, and you get larger breasts at the same time in a single procedure. Number 2, breast mastopexy, breast lift, will cause a scar. You said big implants will help lift my breast, but I think I would like to have a breast lift anyway.
Anyway, we can provide you the breast lift because you have scars as well. We have no fear about the scars.
Now, the extent of the scar will depend on the level of sagging. Sagging is known in medical terms as ptosis, P-T-O-S-I-S, but I'm going to keep saying sagging. If your breasts are only slightly saggy, then your nipples don't need to be moved up very high, and therefore the scar that you'll get from the incisions that are made to your nipples will be quite small, quite minimal. It may well just be a scar that goes around your nipple, which in a lot of cases will just blend in with the nipple anyway, so it will be like you've got no scar. If on the other hand you've got really droopy, sagging breasts, then you're likely to end up with a stripe that runs from your nipple to the bottom of your breast. That's what I've got. Now, as you can see, I've got these scars from my original lift.
Your scar for previous surgery, it was like G, a G letter. But he wants to take excess skins from here as well, and he needs to do it in shape of T.
In other words, I'll still have this scar,
Yeah.
and I'll have another scar.
Yeah, exactly.
Okay, and...
But it will be under the boob, it will not be seen, like the other one.
So you need to see before and after pictures of breast lift procedures. If you can see how the breasts look, say a year after, 2 years after, 3 years after, that will help, because you'll want to decide whether you actually prefer having a scar to having sagging breasts. The before and after pictures are such an important source of education. Also, there is some good news. There are actually some really effective techniques or products that can be used to make scars as faint as possible. There are laser treatments, there are some really good scar creams, and I actually have videos coming up on both laser treatment and scar creams. There are other things that can be done to scars to make them as faint as possible as well. I'm just raising the two that I happen to know about.
Because the appearance of scar is also about how you do stitches as well. So he's really best about it. So I don't think you will have.
Önereceğiz kendisine. Silikon bant önereceğiz onları.
There are some silicone tapes that make the healing more speedy and looking really much more better. So he says after surgery he can advise you silicone tapes that he is going to show you. It really helps for better healing. When you use these silicone tapes for 6 months, it really helps really speed recovery and healing and looking as well for scars.
Number 3. Before you have your breast lift, establish with your surgeon how high up your nipples will be raised. In other words, what height on the breast they will sit.
This one be uplifted 1 centimeter, this one be uplifted 2 centimeter for the nipple area. And taking the excess skin as well.
Now, if you're like me and you combine your breast lift with a breast augmentation, you might want to know how high your nipples will sit. For instance, if ever you have to have your breast implants removed and never have replacement implants done. So that's something to keep in mind. Before and after pictures of the breast lifts that your surgeon has done, again, that's a very important way for you to educate yourself. Number 4. Before you have your breast lift, make sure that you have the level of your nipples checked to know if there's any unevenness or asymmetry between your nipples. You may already know, and I believe that most surgeons will automatically check the level of your nipples.
santim. Bunu ayarlayabiliriz.
Normalde 20.
Normalde 20, burada 21, burada 20.
Guarda.
There is a little bit asymmetry between two boobs, like everyone. One of the distance is 22 centimeter, one of it's 21 centimeter.
Half centimeter difference.
Now, a breast lift can actually make any pre-existing unevenness between your nipples even worse. In my opinion, that's not what you want. So again, you'll need to see before and after pictures of the breast lifts that your surgeon has performed. Some ladies don't care about a little bit of unevenness, some ladies do. I think most ladies do care if they end up with seesaw breasts. You know, one nipple up, the other nipple down. So, you know, make sure that as far as you can that you're seeing that you're going to have your breast lift with a top-notch experienced surgeon who's shown you before and after pictures that you're happy with. Try to see before and after pictures showing how breast looks, you know, like a few months after, then a year after, 2 years after, 3 years after the breast lift. Number 5. This is something that I knew before I had my breast lift, which I had in combination with my first breast augmentation, and it's something that I acted on. If you've got very big nipples, they can be made smaller during your breast lift. Number 6, ask about the effects of pregnancy coming after your breast lift on your breasts. And I think it's quite obvious that your breasts are very likely to sag if you get pregnant after you have your breast lift, you know, if you're going to be breastfeeding. And a breast lift can be redone, but still, just check the point with your surgeon. That said, many surgeons recommend that a woman should delay having a breast lift until she's finished having babies anyway. Number 7, ask about the effect of aging coming after your breast lift on your breast. And again, I think it's clear that it's very likely that with age, our breasts will sag again.
What is this and this? This is under muscle protest. Yeah, definitely. But this breast tissue is built up, and your age is
Causing my
this
breast
is
to
normal,
sag.
yes.
Ptosis.
Sagging breast is normal.
But what we can do to delay that sagging for as long as possible is to wear a very strong bra every day. And as we know, a very strong bra can still be a very alluring and attractive bra. Number 8, ask your surgeon before you have your breast lift about the potential impact of your breast lift on your nipple sensation. Whenever an incision is made to nipples, the nipples go numb, but usually it's only temporary. You get your sensation back in your nipples a few weeks after. Occasionally though, it's permanent. So just raise the point with your surgeon and, you know, just be educated. Now, my breasts have been operated on, on a number of, 4 times to be exact. And basically, my nipples have been cut off 4 times. I have always regained the sensation in my nipples. Now, I don't know how much I would care if my nipples were to become permanently numb, but I hope I never have to find out, I have to say. Number 9, excuse me. For the first 2 weeks after your procedure, you can't drive and you can't raise your arms very high because both those things could spoil your healing. So make sure you're prepared. Make sure you understand that for the first 2 weeks, you can't wash your hair yourself. You might get somebody to do that for you. You can't raise your arms very high. You can't reach up to a shelf. So again, just be prepared. And number 10, I've already mentioned this, a breast lift can be redone, and where possible, the surgeon will use the scar from your previous breast lift.
So we can fix it, and we have uplifted your breast as well, and then that's gonna be perfect result.
So you're using the same scars?
Yeah, of course.
Okay.
Of course. Why not?
So, getting a breast lift, breast mastopexy. 10 things to know first. I'm Gina, I'm 46, I'm from London, England, and I've had masses of cosmetic surgery, but I don't call myself an expert because I'm not a cosmetic surgeon, they're the experts. I don't know the first thing about medicine, but I still feel that the advice that I can share from my first-hand experience can help you if you plan to have a cosmetic surgery procedure like a breast lift. So you tell me, do you plan to have a breast lift? And if so, do you think the advice that I've shared with you in this video is useful? Do engage with me in a comment. Now, you may also be interested in having a breast augmentation, a boob job, whether in combination with a mastopexy, breast lift, or on its own, in which case I recommend you to watch this video that I've done showing you what I wish someone had showed me about a boob job, a breast augmentation before I had mine. And thank you so much for your time with this video. Bye.